When you're looking at your medication chart, one of the first things that you need to do is to check that all the essential elements of the medication order are present to make this medication chart legal. Yeah. First, before we get into it though, I'd like to acknowledge that a lot of you will be completing your clinical placements in New South Wales health facilities, and a lot of them have transitioned away from these paper-based charts onto e-meds, and so you'll be accessing a medication administration record rather than these paper-based medication charts. But it is important because the requirements for a paper-based medication chart is the same as our electronic-based one, and it's still the onus is still on the registered nurse to make sure that all these essential elements are there so that you can legally dispense this medication. If for whatever reason an element is not present and you dispense the medication, it's actually you that is liable, not just the prescriber that hasn't completed the order properly. All right, so the first thing that you need to check is, does it have your patient's full name present on it? Yeah, so we can see here we've got a full name, we've got Laura Mayer, so that's a check, we've got it. The next thing you need to check is your actual medication order part. So we've got a date. There needs to be a date that the order was written. There needs to be a name of the drug. So you can see here it says paracetamol, and you can see how we're prompted to actually write that it is the generic name and that it is printed as well. The next thing you should check is that there is a dose written here. So it's 1g or 1 gram. Yeah, so you can see how there's different abbreviations, and further down the track you'll see we'll talk a little bit more about abbreviations. So 1 gram of paracetamol. We've got frequency of administration. So here we've got TDS. Now TDS stands for 3 times daily, and the prescriber also needs to write in the times of the day that they want it dispensed as well. The next thing you need to check is the route. So we've got oral. And the last thing that you need to make sure, really, really important, is that the prescriber has signed this order. Yeah, so we've got full name of the person at the top. We've got the date that it was written, the order. We've got the name of the drug. We've got the dosage of the drug, which is 1 gram. We've got the frequency written here. We've got the route. And we have a signature. This is a legal order, and you can now, as a registered nurse, progress to dispensing this medication.